Awesome. Hello, everyone. My name is Gerald Tang. I am the Executive Director of Career Services and Internship Office here at Bridgewater State University. I'm delighted to have two colleagues here, the Mass General Hospital's Institute of Health Professions and our lovely colleagues from UMass Chant Medical Schools here representing from the admissions office and here to talk a bit about behind the scenes and really walking through the process of the admissions experiences like for any of the health related program. Want to give a special shout out to Dr. Alexander Zild, who is our pre-health advisor here at Bridgewater State University, and thank you for the partnership and supporting this particular program as well. And we have other two colleagues, Tracy and Jill, from our office here, will be filling questions throughout this recorded sessions. For today, we'll go ahead and get started with the conversation. We want to jump right in and to give you guys more opportunity for asking questions and learning from our esteemed panelists for today. If that's okay, I will go ahead and start with Lauren, if that's okay with you. I would love for you to start by sharing a bit about maybe your role and obviously a bit more about the school and some of the health related program that you have available as well.
Yeah, thank you so much for having me. My name is Lauren Finn. I'm Director of Admissions at MGH Institute of Health Professions. So you may or may not have heard about our school before. We are strictly a graduate school and strictly for health professions. So we are comprised of three schools. We have a School of Nursing, a School of Health and Rehab Sciences, and a School of Healthcare Leadership. The School of Healthcare Leadership is within the last probably 2 years. We were originally founded by Massachusetts General Hospital in the 1970s as a school of nursing. It was a certificate program then, and since then we now have an accelerated bachelor's program. We have a direct entry Master of Science in Nursing program, and our nursing programs really range from the entry-level professions for RN and NP licensure preparation, all the way to a Doctor of Nursing practice. So in everything in between. If you know anything about nursing, there's many different avenues of how to get to your end goal. And much of it is about thinking of the population that you want to work with and serve. So that's just something that we can talk through. The other school of Health and Rehab Sciences, there are a number of programs and I'm going to try to get them all. But for those of you that may not like kind of the blood and maybe the guts of healthcare, I would say genetic counseling may be the program for you. If you like statistics, if you like genetics, that's one of our newer entry-level programs, and we have a Master of Science in Genetic Counseling. We also have our Doctor of Physical Therapy program and entry-level Doctor of Occupational Therapy. Those are the programs that are helping quality of life, whether it be through physical ways or holistically, I would say, through OT work. OTs are those that help improve quality of life for individuals, right? So we can get into more of that if we have time. We also have speech language pathology programs, ranging from literacy and language for teachers all the way to an SLPD program, a doctorate in speech language pathology. So we really run the gamut for all of health professions as a whole. And then last but not least, we have our physician assistant studies program, which is always a hit with students at many schools that we meet and work with. So PA is generalist trained. Our program is 25 months. And, you want to have that direct patient care. So I'm happy to talk with you through, general requirements and what you may need if you plan to apply to the IHP or other PA programs. But I think I'll stop there and I'll say that we as an institution are founded on the interprofessional model. So we value understanding each of our own professions, but also how each profession and each provider works with each other. So how best can you work on that interprofessional healthcare team to serve the patient and for patient outcomes? So we are very close to you all. We are right here in Boston, Massachusetts, and we are in Charlestown, in the Charlestown Navy Yard. So we encourage you to come to campus, and I'm looking forward to talking with you all today and your campus tours. And I'm going to stop there because I already said I was going to stop, but I'm just so happy to be here. Thank you for having me.
Sounds great, Lauren. Thank you so much. We will definitely have more conversation with you as kind of deep dive into some of the programs and sort of nuances of the student application process. So appreciate that. Next but not least, Megan, I would love for you to share a bit about your school at UMass Chant, and for those students who don't know, and some of the programs that you have available for students to consider.
Absolutely. And we're very complementary to the programs at MGH because we actually have very little crossover, but we're also, just like them, solely a graduate program. So you've probably heard of the University of Massachusetts. There are 5 locations, and UMass Chan is the branch in Worcester, about 45 minutes west of Boston. We are the only public medical school in Massachusetts. UMass Chan does have 3 schools: the School of Medicine, the School of Nursing, and the Graduate School of Biomedical Sciences. I'm here primarily to represent the medical school. Our nursing school is a little different than MGH because our nursing school does not have any direct entry programs. So more than likely, unless you are currently a practicing nurse, you're probably not looking at our programs anyway. So like I said, I'm going to talk a lot about the medical school. We are well known as being the #1 in the Northeast for primary care education. About 63% of our incoming class are in-state. Of those 235 students, about 15 of them are in a joint degree program with the MD PhD. The average incoming GPA for our medical students is 3.87. The average MCAT is about a 512. That's the 83rd percentile. What makes us different from a lot of other medical schools is our specialized VISTA curriculum and our pathways programs. This is not a parallel curriculum, but a lens to explore your clinical education. There's a lot of small groups, it's practice-based, and there's early clinical from day 1 experiences. The VISTA curriculum is kind of built on 3 pillars: the clinical, hands-on; biomedical, the stuff that you do in the classroom, the science; and health systems. So talking about social determinants of health, talking about public health, things like that. So it's not just about what does the vaccine do and how do we get it into arms, but truly, how do we get people into the offices to get it into arms? How do we get the vaccine distributed? So it really focuses on all the ways that healthcare is delivered. And that makes it a very unique curriculum and very popular, and probably why we're #1 in the Northeast for primary care.
That's
I'll
great.
turn it
Thank you,
back over
Megan.
to you and welcome any questions.
Yeah, Megan, let's just stay with you for 1 second. You touch upon a few things, so we're gonna unpack a little bit more as we have the conversations continue on. But one thing that I would love to kind of for you to talk a bit about is you talk about the distinctions, right? What makes UMass Chan unique, and Lauren, you touch upon what makes MGH and a program unique. How does one, or how may a students really be able to discover that? Because there's so many really graduate programs out there. There's certainly many med school. There's so many health related programs out there. How might the students kind of be able to find out the unique offering that UMass Chan may be fantastic for this school in comparison to the other? So how you could recommend students to go about research for these sort of unique programs or special program, I guess.
I can tell you, I previously was a pre-med advisor. So this is one of the things that I did with my students, is talking to them about school selection. And it's really easy to go on MSAR and see where your numbers match. However, if you dig a little deeper, you realize your numbers match like 90% of those schools on MSAR. There's not a lot of variance between all of them. So it's not just about the numbers, it's about the mission. Read the mission statements. And if you read a whole bunch of them in a row, you kind of go, they all sounded the same. But really dig a little deeper, because schools have taken a lot of effort to go through their strategic plan and figure out what their mission is. Look for things that resonate with you. Is the word service in there? Is the word leader in there? Is the word technology in there? What kinds of words really resonate with you? Does it talk about clinical or not? Does it talk about research or not? Then take a look, like I said, and if you want to dig a little deeper, look at their strategic plan. Look at how they want to grow over the next few years. How do they involve their students? Take a look at what the student culture is like. Do the students talk about how they found mentors that look and talk and think like them, or are they having a little trouble with that? Does it seem like a welcoming community? Does it seem like a competitive community? And which one is it that you're looking for? All of those are, they're kind of a spectrum, and there's no good or bad. It's what appeals to you or is a turnoff to you.
Can I
That's
just add to
awesome.
that? Megan, that's a great point. And I'm so glad that you're saying this because it's what I say. So I'm happy that I'm saying the right things. But another aspect is what type of medicine do you want to practice? And this might be more relevant for medicine than PA or nursing or so forth. But because of what type of hospital are you near? Like what type of rotations are you going to get? So do you want rural medicine? Well, then being in a city might not be the best. But if you do want something that's more city, then that would be better because you're going to see more accidents or you're going to see more rigor, not sure what's the best way, you're going to see more different cases than you might if you're just going to like Iowa or something. So that's something also to be like where you're going to get your hospital training.
Absolutely.
awesome.
And one of the things I do remind students too is those who are juniors and seniors as undergrads and thinking, I'm definitely going into this specialty. You probably aren't. The few times that I've seen that there's an exception to that, maybe pediatrics, maybe people interested in women's health, OBGYN, and then primary care, people who are really thinking, I want to serve the community, I want to go into primary care. But people who come in as a junior as an undergrad and are like, I'm definitely going to be an ENT. I'm thinking, yeah, probably not actually.
That's helpful. Thank you, Lauren. And for those of you who don't know Dr. Alexander Zill in BSU, you need to really stay connected with her throughout your time if you're interested in any of the pre-health programs or pre-health preparation, which we're going to touch upon a little bit more later on today as well. But before I jump into that, Lauren, anything you want to add? How do you distinguish and find out if they want to go into PTOT, for example? There are
Yeah.
programs out there. How do you sort of make students distinguish themselves on finding out whether or not they go for MGH or other program?
Yeah, so I think maybe 6 or 7 years ago, we were one of the first schools, certainly in the region, to talk about interprofessionalism and interprofessional education. And now everyone says that. So, I think it's all about looking and visiting and talking to students, talking to faculty, talking to alums if you can. I know that I can be a resource to prospective students, but I know no one wants to talk to prospective students want to talk to current students. So we have admissions ambassadors, we have faculty that are ready to talk to you all. And that's what I would say is listen to the students, listen to the faculty and see where that connection is. And your graduate education is an investment in you. So find somewhere that also wants to invest back in you, right? So that would be my suggestion.
That's awesome. So, while I have you, Lauren, why don't we share a bit about perhaps, is that a standard admission timeline for your program? Is there a fluid? Can you share a bit about what's the timeline like in general if the student are considering, graduate program at MGH?
Yeah. So I feel for applicants right now because there really is no right or wrong when it comes to admissions. There's many deadlines, there's rolling admission, there's priority, final, there's you name it, and there's that option, right? So I would say, get it down to, 5 schools that you're looking at when you know what profession or what program or what specialty you'd like. When you have that, try to get either a spreadsheet or a calendar up, and then you research the timeline. Whether it be rolling admission, it's all based on when the entry term is, so kind of work back from there. But for the most part, our programs, so for PA, for PT and OT, they all use centralized application services. So what that means is there is one cycle for every year. There's a start opening of the CAS cycle, and then there's a closing, and then there's deadlines for institutions that participate in the centralized application within that cycle itself. So I hope you all use that as a tool to not only shop around and research the schools, but there's a way that you can actually look at the timeline and the calendar also and keep yourself accountable for deadlines. But if your admissions office that you're working with is anything like us, we love sending reminders. So we'll do our best to remind you of upcoming deadlines if you're considering our school. But it's also your responsibility as a prospective student to look up those deadlines if you want to remain compliant and eligible. But please know we do our best to send reminders as much as we can.
Lauren, for this is actually for both Lauren and Megan, but you said something that brought up a question. How many schools do you think, like, so let's say you're applying to nursing school, PA school, or medical school. Let's just do that. Something like that. How many schools should people be applying to? Because students come in sometimes they're like, we're going to apply for 40 schools. I'm like, you don't need to apply to 40. So based on your expertise, what are you recommending?
So Megan, I'll start. So what I would say is we're seeing less students apply to multiple nursing programs than we are, for instance, PA, PT, not OT. So it really, I think, is about the profession. I think when you are interested and you know what program you want to go to and you meet those admissions requirements, I think you should apply to that school. But we know that, you are looking for, affordability and a number of different factors. So when cost of living is a factor, I know we're going to talk about that later on, but it does vary. So yeah.
That's awesome. While we have the topic, right, let's kind of walk through the journey of the students. Let's say they're thinking about, going to health related programs and all the way through the admissions timeline. So let's kind of walk through that stages and maybe posing questions from that lens, right? Let's say I'm a student, I'm undergrad, I'm going into, I'm continuing my study, I'm an English major. Now I want to go into medicine. I think about medicine, but I don't know if med school or whatever school that or other related program that they're considering. What would you advise students on? Like, what would the first step like do? Is that a prerequisites, type of classes that students need to take? Like, somebody who never connected with Dr. Seal yet, and what might be something that way you recommend student and based on the program that you recruit for?
Funny you would say that. First thing I would say is you need to connect with your pre-health advisor. That's your first step. Second thing is there's two different questions there. First is the question of discernment. What do you want to do? Are you sure you want to do it? How do you find out if this is what you want to do? And there are two things that you're going to want to do: inside the classroom, outside the classroom. Inside the classroom, start taking those prereqs. It's one thing to say that you want to go into a health-related career. It's another thing to take organic chemistry. So take those prerequisites, see if this is truly what you want to do. Start taking the science classes. Start with Bio 1. Start with Chem 1. Then go from there. If you're doing well in those and you like those, keep going. If you don't, talk to your pre-health advisor, because there are things that you can do where you're still going to work with patients, you're still going to make an impact, but they're not going to be quite as intensely science focused. So it's not a no, it's a yes and. If you are sure that you want to go into medicine in particular, the timeline is really, really long. And what I always tell people is let's work backwards. So if you want to start in X year, you have to apply June the year before that. So all the people that we are reading applications for right now won't start until fall of 2025. Those applications are already in. We're still taking a few more, but essentially you apply 1 year in advance. And by apply, I mean you've already taken all your courses and you have your MCAT. So when you hear people taking a quote unquote gap year, bridge year, whatever you want to call it, it truly is in some ways a gap year because your application's already in. It's not a year to get your prerequisites or a year to study for the MCAT or a year to get clinical experience, because your application's already in. It's building more, and you can tell the schools about that. But if you apply to medical school without something in your application, you're like, oh, I'm going to get it during my gap year. Yeah, I'm totally going to shadow Dr. Smith, I promise. Yeah, I believe you. You got to do it beforehand. So make sure that you're looking all the way ahead and saying, I'm going to have this stuff in place. Then there's another whole year while we're reading applications, we're doing things like this, we're doing the interviews to choose the class. So knowing that, working backwards, so you've got a year before you want to enter, you got to have that MCAT done. You got to study for the MCAT, and you got to take all those classes. I had this one pre-health advisor that did not believe me that you had to take biochemistry before taking the MCAT. And we had this big discussion about it. I'm like, it's on the MCAT. How do you not take it? But yes, you have to take all of those prerequisite courses first, then take the MCAT. So now you see why some people are looking at a lot of things outside of medicine. It's a lot to do. And you really, again, that discernment is a big part of it. Because if you're not sure and you're not committed to it, it's a lot to do and you're not going to be happy. You're going to get frustrated with the process. If you know this is your goal, you're going to have that motivation and you're going to be able to keep going.
I
That's
think also,
great.
I think another important thing, and I also have a question I just want to add to it, is the clinical experience. So I always tell people, even with nursing, you don't necessarily need clinical experience. Get into the hospital, because if you'll find out if you like blood or not, or you'll see if you enjoy it or not. So actually having that clinical experience can also help you figure that out, but also talk to different providers. Do you want to be a PA? Do you want to be a PT? Do you want to be a nurse? Do you want to be a doctor? And that's really helpful. But I do have a question. So let's just use PA for Lauren and then medical school for Megan. So we know that you should apply by June if you want to apply to med school, and April, the third week and the third Thursday of every April is when PA applications open at CASPA. How late, and students will say, well, I'll apply later. Like, when is the window of applying, and when is it like, you can still do it, but you're risking it?
90% of applications to both medical school and PA school will happen within the first month. So think about it as and same thing with any secondary applications when they open and are sent out and that kind of thing. I always say, think of it as this ever expanding queue. Where do you want to be in that queue? And yeah, the queue doesn't end until here. However, where do you want to be in that queue? We read applications in the order that they're complete. So if we take applications until, 4 months later and you apply the day they're due, we're not going to read your application for another couple months after that. And if we've already filled out all of our interview spots, there's not a lot we can do. UMass Chan is not one of them, but I do know of medical schools who stop reading applications at a certain point. And every med school, every grad school is going to tell you, you can apply all the way up to the deadline because they want your application fee. But I didn't actually say that.
It's on
We're
recording,
not-
so oh
Yeah,
well.
we're not recording this, Megan, don't worry.
But we do, like I said, at UMass Chan, we are going to read those and we do look at every application, even those that come in at 11:59 p.m. on the deadline. But again, what can we do when everything is full by that point? No matter how great you are, we don't leave spots available going, just in case there's a few at the end.
So within the first month is really a good rule of thumb. Thank you.
It is across the board. And yes, there may be things that prevent you because you want to have more experience before you send this in, or you're waiting for a test score or that kind of thing. So there's a little bit of leeway, but as a general rule, if you're going to apply, if that opens up in June and schools say they take it until January, you're 6 months late.
So I just
Lauren,
want
what
to
about
jump
you?
in here. Yeah, I want to jump in here because we're very deadline driven, and most of our programs, like I mentioned before, use centralized application services. So we don't collect the application fees ourselves. They're going to the actual association and service. However, so most of our programs that participate in those annual CAS systems, we do have deadlines, and our deadlines are there to allow applicants time to submit their application. So we don't review applications until the deadline passes. So PA is a little, yeah, so it's the exception of rolling admission. We have one of our nursing programs, which is the Accelerated Bachelor of Science in Nursing program, that's rolling. So those applications are reviewed probably within a month of receipt, and decisions are sent out that way. But all of our programs they do not review applications until either the priority deadline or the final deadline, whichever may come first. And that's just to remain
There's a
equitable.
difference. Is that just for MGH, or are all like your types of programs doing that? So it seems like I've heard this from med schools before, saying they do it as they come in. So is this an MGH thing, or all PA schools or all nursing schools?
Most schools that I know of in the not MD, right, non-medical schools,
Right,
unless they're rolling admission. So rolling admission is first come, first serve, really. So we are continuously reviewing and admitting students in a rolling manner. If there is a deadline, in an equity standpoint, I would hope that if there was a deadline that we would uphold the deadline, and then there would be a pool of applicants that will be reviewed, and then granted a decision in that way. But that's just, I can speak for my colleagues in graduate enrollment management. But
Thank you.
yeah, of course,
great.
because there's also interviews too, which is another piece where on the rolling admission piece, it's difficult if there's, continuous interviews, but you need to know if there's, if you'll be eligible for the interview after that deadline passes. So it's more of a swift process. It's like
So Lawrence, well, I'll stay with you for a second. We talk about we're approaching the whole application process, right? Which let's get into it, right?
Yeah.
What are some of the components as required? Essentially, like every program will need you to have, and let's just kind of unpack a little bit there, right? For students to know, like, what do they need to put together for the application process itself? And if there's any exam that is required, what are they? Obviously, Megan, you touched upon it a little bit already for med school, MCAT. What will be preparation that you advise students on? How often or how many? Let's just unfold a little bit. Lauren, starting from you, what are the application components perhaps you can share?
Sure. So I'm going to start with PA because I really like what Megan shared about once you know an application deadline and knowing the requirements, working backwards. So for instance, our PA program, you need to have all of the prerequisites completed at the time of application submission. So what that means is you don't want to actually submit your application if you have courses in the summer that are still outstanding, and you want to wait until you submit your application after that point. And that is so that the reviewing committee knows and is able to assess your prerequisite coursework when they're completed. The other thing is thinking about direct patient care experience. For our PA program, we have 1,500 hours as a requirement, and you'll need all of those hours at the time of application. So if you're still working, you want to make sure that you have as many hours as you can, and then submit the application that way. Other programs have prerequisite requirements and timeline based. So you want to narrow it down to a few programs once you know the profession that you're interested in. And then really look at those requirements. So for our programs, we have essays, we potentially may have supplemental essays. The other thing is, I just want to mention, make sure you put the school's name right in the essay. Double check that, because that's really alarming thing. We get that all the time. But letters of recommendation are pretty standard. They should be those that are close to you, that can attest to your leadership, your compassion, your empathy. I mean, this is a graduate level application, so they should not only just be able to show your academic ability, but also your knowledge as a person and what great, compassionate healthcare provider you'll be. And then prerequisite courses. So really, it's a lot of logistics, a lot of timeline, but if you understand the requirements, which we're here to help throughout the process and answer any questions you may have, it should be pretty straightforward in terms of the application itself and what's required.
All right, thank you. Megan, anything you want to add from the med school's point of view?
No, I agree with my colleagues. As I mentioned, when you're doing the discernment and when you're getting ready, both inside the classroom and outside the classroom, you've got to have those clinical experiences. I know a lot of people who say they want to be physicians or they want to be nurses, but do you really know what it's like to be around hurt and sick people who aren't your family members? And do you really know what it's like to care for them? And is that something that you want to do? There's an old joke about the guy who worked really hard to get into med school, and on the first day he passes out at the sight of blood. That doesn't happen anymore, because by the time you get to med school, you've got clinical experience, but you want to make sure that you're not the person that passes out at the sight of blood, because you're not going to make it very far in health professions in a lot of the fields if you can't do that.
Got it. And Megan, to clarify the clinical experience part of it, volunteering opportunity is fine. Shadowing opportunity in hospital systems is fine, or being a CNA or being involved in the healthcare system and the patient care aspect is okay. Just want to clarify what
Absolutely.
that means.
Absolutely. So there's a few different kinds of clinical things. One is shadowing. Shadowing is good. Shadowing is important, but shadowing is not hands-on. Shadowing, it kind of falls under the big clinical umbrella, but shadowing itself is not enough. That's following somebody around and not doing anything, not truly interacting with patients. A paid position or a volunteer position. Some people ask if one has more value than the other. It really depends on the position and what you get out of it. And I also agree that it depends on where you're coming from. Some people don't have the opportunity to volunteer. I've got to get my clinical experience and I've got to get a few dollars to help pay my tuition or pay my rent. That's completely understandable. Or some people are coming from an environment where the only thing that I can get, because I'm not qualified and I don't have any specialized training, is to volunteer at the hospital and be a wayfinder or whatever it may be. That's totally understandable as well. Any of those things are valuable. What's going to be important, as Lauren was talking about, is what you put in your essays. When you're putting together your applications and when you're putting together your essays, you're not just going to give us bullet points of the things that you've done, but you're going to reflect on them and think about your patient interactions, what you've learned about the interprofessional way that team members respond to emergencies or long-term care, what you've seen about the healthcare system. All of those things are going to be important. That's why you want to have those experiences, to know this is the career I want. This is how it's going to be. We want to make sure that you have the right kind of expectations for the short term and the long term.
That's great. Thank you. And Lauren, what about you? Any prior experiences that you recommend students to take advantage of before they're applying for any of the health programs?
Yeah, I think shadowing is a great, surface level interest, especially if you're between two professions. Better to understand the profession prior to, moving through the prerequisites and the process there. But for PA school, like I mentioned before, the direct patient care experience does have to be a paid position. So medical scribes, CNA work, PA assistants. So a number of those areas, you want to make sure that it's a paid position as you build your experience.
And a shameless plug here that our office do have many resources and positions available throughout the year on Handshake that you can take advantage of for you to pursue any position in the healthcare sector, in the surrounding region. So students in the room, don't hesitate to look on Handshake for some of those positions that both Megan and Lawrence have shared. I saw that you unmute. You want to share anything else?
Well, I wanted to ask something. I just didn't realize, Gerald, that we were going to have commercials during this thing.
Well, it's our program, so we have the shameless plug on our end for our
Oh, I
students,
love
right?
shameless plugs. I love shameless plugs.
Public service announcement, not a commercial.
Yeah, it's a PSA. I like that. So Megan, something I learned when I started as the pre-health advisor here, I spoke to someone from admissions at UMass, and specifically they said they really like and actually will only look at you if you have research experience. Is that true? Like
Research,
specifically your school, because I know not
right.
every med school is like that.
Research is not 100% required. Like you don't have to be published to get into medical school. Having research is going to be important, especially when you're looking at a research-focused MD program like ours. And what kind of research that is, it doesn't have to be lab-based, test tube, that kind of research. It doesn't have to be science-based. Maybe you've done some public health research or you've done some psychology research. What the med schools want to see is, can you use the scientific method to solve a problem or answer a question? And sometimes you can get this through independent study research. So you're kind of, in some ways, double dipping. You're getting that experience, and then you're also getting some course credit, some advanced credit in your major. Sometimes this comes through a paid position. That's okay too. But what we want to see is that, like I said, can you use that scientific method to solve a problem or answer a question? So it can be historical or arts-based research. Absolutely. And what you want to do is make sure that you're showing how you use that. Because as I was saying, the question of the vaccines, it's not just about how do we create them, but also how do we get them out there? So if you're someone who thinks about things in the social sciences realm and in the humanistic realm, that's great. We want that in medicine.
So could a student, because I sometimes have students who can't get research because they have to work to pay bills and stuff like that. And so they're working as a EMT or something. So could they still apply if they don't have research, or should they not bother applying to UMass Chan if they don't have research?
They can still apply. What I would do is focus on some of the research that some of the advanced research that they've done in courses, even if it's a smaller project, talk about that smaller project. In one semester, I did this, for my fourth year level course, that kind of thing. Focus on that so that you can answer a question if you're asked in an interview, tell me about a research project that you've worked on. How did you use the scientific method on that project? They aren't caught off guard.
Got it. Thank you.
That's great. And speaking of that, we talked a little bit about that, touch upon this topic, but I'd love to kind of go deeper into that. Test scores, GPA, which one is more important? Which one is less? How do you weigh that? Like one might have higher test score versus lower GPA. Is it accumulative or is only specific to the prerequisites courses that admissions committee look at? Lauren, let's start with you. What's your thought?
I have lots of thoughts on this. The first being we are proudly not requiring standardized tests for all of our programs. Our PhD in rehabilitation sciences program starting in fall 2025 will not be requiring the GREs for the first time. With that being said, we have implemented some minimum undergraduate GPA requirements or minimum graduate GPA requirements. Several admissions committees look at, we take a very holistic approach to review. So we want to look at the whole application. You want to present yourself in the best light. But, looking at your prerequisite courses, looking at your science-based courses, and it's okay to retake a course as well, right? So looking at all those different factors and kind of having that well-rounded application, I would say is much more important than the standardized test in terms of the IHP's standpoint. But there are still minimum requirements for our nursing programs, for instance, like that 2.7 undergrad GPA. We do require if students have received their undergraduate degrees outside of the US, we may require a TOEFL or an IELTS score. But with the exception of that, for standardized tests, there is no standardized test requirement as of right now. There's a PA CAT that actually just came out over the last year, and that's test optional for our PA program because they're just now looking at any predictory data to see if it will show if those scores will show success in the program and on the PANCE rate. So that's an option. It's not required.
Will it hurt someone if they don't take the PA CAT?
Yes, definitely. Yeah, it's not
Oh,
required.
no, but I'm saying, will it hurt someone if they don't?
Oh.
Meaning, like if you're comparing, no, okay.
No, it can't. It's not an application requirement. In my role, I want to make sure that there's equity in our admissions process. And if it's not a requirement, it will not be considered as part of the application.
So this is and I want to hear from Megan also. I know that Gerald's going to want to do that, but can I ask you a question? Because this is something that I hear a lot about. If a student doesn't do well on a certain class, let's say it was their first, so for us, biology 1 is 121. It's always the question, let's say they got a C, or C- or something. So I always know that they have to at least have the prereq requirement. Is it better to take that class over, or is it better to show proficiency in the higher level biology classes? Because that's a question when you're trying to have someone graduate in time and there's so many classes they have to take for our major. What is the most strategic way they can go?
Yeah, so I think looking at, you want to meet those minimum requirements no matter which way, because without that minimum requirement, they wouldn't be eligible for admission consideration. So if they take a higher level biology class and meet that minimum required grade and show improvement in those science-based courseworks, that says something. So that would be my best case scenario for a student who is improving their science skills throughout their undergraduate studies.
So in that case, you would say, oh, sorry. Go on.
No, go ahead. I was going to ask, at what point is an applications that can student explain any changes or any transition, right? Is it
Yeah.
in the essay part? Is it additional supplementary information? Say, hey, my first semester in my first biology class, I have this whatever personal matter that had to be addressed, but then
Mhm.
improvement happened. Like, is there a space in the application? And if not, at what point can they address that?
There definitely is. And we added that because we wanted students to be able to showcase and not necessarily feel as though they have to try to find a place to put it in the application. We have 2 custom questions on our CAS applications, one of which is being if you have any withdraws, Fs or Ds on your transcript and you'd like to explain it, here's the place to do that. The other question is if you have anything else you'd like to share with the admissions committee, here's your opportunity to do that as well. So like I said before, every piece of the application is reviewed and we want to make sure that students are looked at for all of their hard work, not just for the grades and the paper that we're seeing. So those 2 options are there for students on our application.
Would
Sounds
you,
good.
if the person writing a recommendation, let's say the professor gets to know them and the professor knows that situation and the professor puts that in the letter, is that also a good thing?
Definitely. I think the more any letter of reference that can speak to, I feel like I'm talking too much, Megan, jump in here. But any personal anecdotes or examples that a reference can provide in support of the applicant, tremendous. That's exactly what we're looking for. So yeah.
So Megan, let's go to you, right? So repeat the questions for you.
Sure.
GPA, test score, we talked about briefly, and obviously essay. But I'm gonna throw in one more spin for you, because since why not? What about if I'm a transfer student? I did my first introductory biology class in a community college, did poorly on that. Now I transferred to BSU, did excellent in a advanced biology class. What do I do? Do I need to explain, or does it assume because a different school?
So there's a few things that are different about med school, not just UMass Chan, but med schools in general. And med schools are extremely competitive to get into. And GPA and MCAT are required at all US MD programs, and we look at them. There are some websites out there that will tell you that they have the algorithm for this school or that school, and you can pay them and they'll tell you they're a bunch of bunk. Because if there was an algorithm to get into this school, I wouldn't have a job. People are what's reading the applications. There's a reason that we have interviews. There's no algorithm. There are some algorithms that help us sort some of the applications because we need things like, we do not have a quota. There are some schools that have a quota for in-state and out-of-state based on the money from the legislature. So they may have a quota to sort people from in-state and out-of-state. There are some schools that have other kinds of minimum stated MCATs or GPAs. We don't have a minimum stated MCAT or GPA. You can see what our range is each year on MSAR. You know what our average is, but average means half or higher, half or lower. So that's how we get that number. If you are below average on both of those, does that mean that you stand no chance of getting in? No, you've taken statistics, so there's a chance still. But look at that and think about what those numbers mean. But we are an academic program, and those academic indicators are some of the best things that we have to indicate that you'll be successful in an academic program. And as problematic as we can argue the MCAT is, at the same time, the medical profession is a profession of tests. You're going to have to take the step 1. You're going to have to continue to take the qualifying exams to keep your licensing. So you've got to be ready to take those exams. If you're someone who is very, very, very test phobic and you're not sure that you can do that, think about that. Know that this is going to be your career. Sometimes I talk to people who have a lot of anxiety with things like that. And I say, so what are you going to do in the ER when you have to make a decision to save someone's life? If you're not sure that you're ready for that kind of pressure, maybe these are careers that aren't quite ready for you. So think about those things. So that's why we take those tests pretty seriously. When it comes to things like transferring and it comes to low grades and things like that, I'm going to make the assumption, I know we talked about it before, that you apply to multiple medical schools. I don't know what the national average this year is. I think it's about 12 to 14 is usually the average number of medical schools that people apply to. Your magic number is your magic number. If somebody wants to apply to 40 schools, I always tell them, great. You have to pay the 40 secondary application fees, and you have to fill out the 40 secondary applications with all the essays, including the one at Duke that's like 6 essays. That's crazy. So think about the fact that you're committing to that. You can always put something on your AMCAS and then not fill out the secondary. But that's like what, $37, $39 for each one that you do that for, and then you don't apply. Save that $39 and go to Chipotle. Think about it ahead of time. Save your money. Only apply to the schools where you really see that you're going to fulfill that application. Take the time and effort to do it. Now, knowing that, most medical schools have a requirement that for all of the prerequisite courses, you have to get a grade of C or better. So C minus is lower. If you get a C minus, you have to retake that course. Not every medical school has that, but most of them do. And so therefore, you're going to have to meet the minimum of all the medical schools that you're going to apply for. So more than likely, you will have to get a C or better in all of your prerequisite courses. So if you don't get a C in it, you will have to retake it. And does that mean, as you were saying, could I take a more advanced course to prove that I can do it? Sure, but you still have to have a C or better in that other course, so you will still have to retake it.
Well, there's a lot to unpack there, definitely. But let's dive into one aspect that even there's a question on the chat related to that. Letter recommendations. I wonder, like, is for the question that was posed here, right? Is it better to have letter of recommendations coming from all medical professionals? I'm going to say generally speaking, or should that be equally between faculty members or academics professionals and medical professional who are submitting the letter of recommendation to you guys? What is better? What is outweigh one or the other?
So there are different programs that will have different requirements. One of the things that I would say to kind of touch all the bases, again, you're going to apply to lots of schools. So instead of trying to get letters of recommendation for this school and that school and that school and let's think about it in general and what can you do to meet the requirements for like 99% of them. Many medical schools will say they need at least 2 recommendations from science faculty members who have had you in class. Most medical schools will say that they want somebody who knows you in a clinical capacity. So whether that's a supervisor at a job or a supervisor at a volunteer experience, then some people will want to add in another letter of recommendation from an extracurricular or maybe a humanities class or maybe both of those. If you do that, so you've got 2 from science, you've got your clinical, extracurricular, humanities. Don't turn in more letters of recommendation than that. If you get a committee letter, that's separate. That's different. However, don't turn in more than 5 letters of recommendation to a school. 1, we don't want to read all that. And 2, when we see that, that is a red flag that you are overcompensating for something. When you send us a letter from everybody that you've ever met, that's a red flag. Also, you want those letters to be from people who are not parents, are not people that work for your parents, people who are not other relatives. I often will say, if you're getting something, your last name is Smith and someone named Smith is writing the letter, don't be afraid to tell them, put in there that we're not related. We'll probably assume that, but go ahead and tell them to do that. That's okay. So you want to make sure that those letters are from people who know you well. That is really cool if you can get Barack Obama to write you a letter. But if all he can say is, I met Megan once and she was nice. Versus getting a letter from Lauren who says, I've met Megan and here are all of the things that she can do that are going to make her great in this profession. That's going to mean a lot more.
That's helpful. Quality substantial, right? Rather than just, check off the box, we always say.
Absolutely. And that also means start those relationships with your faculty members now. Start talking to them and say, hey, I'm not going to apply to med school for a little while, but I want to keep in touch with you and tell you about what I'm going to keep doing in biology or the courses that I'm going to keep taking in chemistry. Can we meet once a semester so that we can keep in touch so that when it's time, we're not going to feel like strangers and you're not going to write a letter that says, Jill was in my class 4 years ago and she got an A, so I'm sure she's really smart. No, here's how smart I know Jill is.
That's helpful. Thank you. Lauren, what about you? As a letter
Yeah.
of recommendations.
Those were great points. I really don't have much to add. The only thing I would say is that for our programs, we usually require 2 recommendations, and just to round out the application, 1 academic, meaning someone that can attest to your academic ability, and then 1 professional. So a direct boss, a direct manager, mentor, anyone that can attest to your leadership skills and your future in your profession. I think that would be ideal in our mind. But all of those points are, Megan, touche. Well done.
That's awesome. Thank you for both of you first. Let's switching a little bit to a different side. What about work experience? Like, okay, I know I'm not ready yet after graduate at BSU. I want to get some experiences. What happens if I'm not in the medical field for just a short period of time? Maybe they do something completely different. Couple years later, they want to go back, and now I'm ready to pursue medical school and so forth. Does the work experience matter? Does it have to be related to the health professions? What's your thought about that?
Yeah, so I think you've heard about gap years. I'd like to, my colleagues at BC School of Nursing, he likes to call it a growth year. And I think when you're presenting your timeline, right? You're presenting your achievements, you're presenting your timeline of employment and education. I think it's a lot about how you present it. So make sure that you're filling your time with, I also think everyone should serve tables and work in retail at one point in their lives because they learn a lot about working with others, right? Working on a team. But I digress. I think you want to think about how you present your experiences, and there's takeaways no matter what experience you have. So learning how to take your experiences and then mold them into what may be helpful for the healthcare field, for your trajectory of your career, I think is really important. But I encourage you to work with career services offices because I know resume writing and that is a big part and really helpful. So they can help you spin that the way you'd like.
I completely agree that working with your offices to find a job is so important. And you do not have to work in the health professions just to go to health profession school. As we've talked about, there are some minimum number of clinical hours that you need to get, but I just put the competencies up in the chat. This is something that I would always talk to students about when I was a pre-health advisor. Whether you are looking to go to med school, you are looking to go to nursing school, or you are looking to, be a pre-health advisor. Almost every single one of those are great professional competencies. So if you're working at Target, you can look at those competencies and talk about how your job at Target works on teamwork and communication and problem solving. Those are all things that I want to see in a chief resident. So every job, every experience, you can relate to what you want to do by looking at the competencies that you're learning on the job. So if you're working in the stock room and you're doing things in supply chain management, you don't have to write an essay about how supply chain management is at the heart of healthcare, but how supply chain management has taught you all of these different competencies that are going to be important as you're working with patients.
I'm going to put Can I put a plug in also, Gerald? And
Of
this is for you
course.
as well as me. But the thing that you all should know is that Gerald, the career CSIP, Career Service and Internship Programs, and myself, Pre-Health Advising, we work with alumni all the time. So just because you graduate, like you do take your, I like that growth year. So kudos to your BC. I went to BU for grad school, so I have issues with that, but I'll get over it.
Oh,
Um, you come back with your growth years and we will still help you. So these offices don't go away just because you graduate. So I just want to put that plug in.
Thank you. Thank you for the in supporting it. Let's jump into a little bit more of that. Does advanced degree matters? Maybe this question goes to you, Megan. Like, what about students pursuing a master's degree? I think, let's say public health, right? And then they now want to apply for med school. Does that enhance the application, or are you only looking at the undergraduate credential at the moment to looking at the admissions requirement? What are your thoughts?
My thoughts are the same thing with any job. Why are you pursuing that MPH? Are you pursuing it because, well, I wasn't sure what else to do to buy some time until I applied to med school? Or I'm really interested in public health and here's how I'm going to use it as a practitioner later in life? That's what you've got to ask yourself, and that's what you've got to be able to demonstrate. I do see people who are definitely using master's degrees as just kind of a resume enhancer. If you are doing a post-bac program, that's what that's for. That's understandable. That's exactly what that is. Some master's degrees are that way. It is kind of a pre-MD MA. That's okay too. But what you want to really think about is, what is the investment in yourself and what do you want to get out of that later? You want to do well in that program because you're spending a lot of money on it. You are investing in yourself, so make sure that you take the time and effort to get good grades and get the most out of that program, because my guess is that your goal is not the MA, your goal is the MD. So keep that in mind. Keep focused on your goal. If your goal is not yet known and you want to do something else with that, that's understandable too. But just keep in mind, where do you see yourself 5 years from now, 10 years from now? If you're not sure, that's okay. But if you are sure, is this really the step on the way?
Thank you, Megan. Lauren, let's go to you. Advanced degree before, let's say they go into the DPT program, right? In your institute, like advanced degree, like a master's degree, matters or not? I'm gonna throw in one more question for you, since I have the mic. What about the dual degree programs? There are many dual degree programs out there. Example would be like, MD, obviously for Megan's point, MD/PhD, or MBA slash what have you, right? Those are something I often see. What's your point of view about the dual degree program or even a master's degree before they apply for a doctoral program? Does it help at all in the application?
so I think it really is dependent on the student's journey, right? So no matter what degree you're earning, no matter what your trajectory is, your pathway to higher education, making sure that you're confident in that path, making sure that you know the value of the degree that you're earning, and then making sure that you're putting that in its best light on your application. The health professions, I mean, it people take various pathways. I mean, we have dancers that were, we have art history majors that are now finding their way in second careers. So I'm less worried about other degrees, more so about how the path brought them back to health professions. If it was something that, they kind of went away from and then came back, it's more about your story and kind of building that and showcasing that. But
That's helpful. Thank you. Megan, let's go to you. You touch upon it, but let's deep dive into that. Interviews. Let's say they got into a invitation for med school interview in your case. How can students prepare? What are the tips and tricks that you have? What are the biggest mistake that you've seen people did in the admission process that really hindered their application?
There are two kinds of interviews: traditional interviews and MMIs. At UMass Chan, we do MMIs. That stands for multiple mini interviews. Also, our interviews are virtual. Almost all schools are doing virtual interviews at this point. MMIs are situational, sometimes scenarios or questions about ethics or kind of short answer essay questions, so to speak, oral essays. If you've heard of the preview exam or the Casper exam, those are situational judgment tests where you will type the answer or you will use a multiple choice answer. MMIs are the same thing, but in person. I like to explain MMIs that they're kind of smart people party games. They're smart people version of Would You Rather, except they're a little more high stakes. When you are preparing for an MMI, work with your pre-health advisor. Your pre-health advisor may even be able to offer you a practice interview with themselves or with someone who has graduated. With
I do that to everyone here.
So,
Sorry.
and talk to them about and find out for sure when you have that interview invitation, does that school offer MMI or traditional? Which one? So you know when you're going into it, what to expect. Practice for that. There's lots of stuff online. Know your source. There's lots of stuff on Reddit. There's lots of stuff on Student Doctor Network. Half of it is good and half of it is terrible. So which half is good and which half is terrible, I can't tell you until I see it. So take a look at it and know there's a lot of trolls out there. They'll post anything. So know who's posting it, what it might mean, and whether that's going to be helpful. Don't be afraid to ask your pre-health advisor. I read this on Reddit. Is it true? I don't mind answering that. Pre-health advisors don't mind answering that. Do you know how many times a day we heard, someone told me, someone told me? Who told you? Did they actually have any credibility? So that's the best way to get ready for the interview, is to practice and know what to expect in an MMI. In an MMI, it's usually a rotation, and you have 2 minutes to read the prompt and think about it, and then 6 minutes to explain it. And that prompt could be an ethical scenario, or it could be something like, if you were on a desert island, what 3 books would you take and why? So it's about not just, it's to get at the things outside of your application. What I always tell people is kind of funny is every school is very specific about whether they want to do traditional interviews or MMI interviews. And they have chosen that direction for the exact same reason, because they want to get to know you beyond the application. And so it's kind of funny that some of them are thinking that the best way to do it is to ask you those questions directly, whether it's a closed interview, meaning the person interviewing you hasn't even looked at your application yet, doesn't know anything about you, or it's an open interview where they're going to be reading it and saying, so tell me about why you said that physics was your favorite class. Either way, they want more than what you've already told them. If they're doing an MMI, they want to know not just what your answer is, but how you get there. How do you decide what's right or wrong? When I say, do you like blue or red, and you say you like purple, that's not actually an answer. So which one do you lean towards and why? So that's what they're looking for in an MMI, is a true answer. They want you to acknowledge where the conflict may lie, but they want you to answer the question and come down one way or the other. And in most cases for an MMI, there's not a right or wrong answer. It's about where you would go and how you would handle the situation.
That's awesome. Lauren, let's go to you. What about you? Do you guys offer interview as part of the admission process? If so, how might students prepare for it?
Yeah, currently our occupational therapy program and our PA program have interviews. And I always like walking over and catching some of the interviewees, the candidates in the elevator. Just, they're always so nervous. And I'm like, no, I'm from admissions. And I always like to say, you're interviewing the school too. And that really puts the faculty on edge. But truly, I mean, when you're applying to multiple schools and you have the privilege and you have been invited to interview, it's a time for you to look at the school, to connect with faculty, to get a better feel for the campus, for the environment, meet other students. Can you see yourself there? I mean, all these things that if you just switch it a little bit, you're thinking, may help you to relax a little bit. So it's nothing more than just a deep breath, and know that it's an opportunity for you to get to know the school a little bit more too as part of the interview process while you're there.
That's awesome. Any tips on practicing, or like the trickiest question, the challenging one that you always feel like students stumped on?
I think that if you do your research and you know what school you're applying to, you'll be able to catch on some, hot topic words like interprofessional education, know about the campus, know about the school, maybe some faculty members that are interesting research. So just making yourself familiar with the school, with the faculty, with the department, the program, connecting with faculty while you're there. Those little things, relationship based, I think will go further in an application for a health profession school that is really built around serving others.
Awesome. So let's switch gear to the last part, right? Or not the last part. Let's say you get admitted, you're excited, you're jumping for joy. Now the question of how am I paying for it? Which is oftentimes a question that we always see students thinking about. So let's dive into a little bit more. Maybe we'll stay with you, Lauren, to start. What are some of the financial options available through MGH for people who get admitted into your graduate programs?
Yeah, so around, I would say 25% of our incoming students do receive scholarship along with their acceptance letter. So we pride ourselves in that. I work with the director of financial aid to try to get as much aid out there for students, because we know graduate education, it's expensive. So understanding the value of that, looking for Grad Plus loans and working with financial aid offices for any outside scholarship opportunities. I know our office has a posting of outside scholarships that are available. So it's really about using the network and using the resources that the schools provide to help you and assist you throughout the process. And I can't tell you enough, making connections with the financial aid office and your admissions offices so that your name is there, so that you know and who to contact for any question throughout the process. That I think is a good suggestion. The other thing we have are graduate assistantships as part of programs. So we have admissions ambassadors. We don't offer work study because we are not an undergraduate institution, but we do offer graduate assistantships. So those are also opportunities for you to help pay for your cost of books and that sort of thing while you're in the program. And we love our admissions ambassadors. So I hope that, you do that wherever you end up attending.
And
To
just one tip.
confirm,
Oh, sorry. Can I just add?
confirm that.
Oh, yeah.
Go
sorry.
ahead.
No, you go and then I'll go.
No. Just confirm that student in the room. That means you need to file for FAFSA, because students always think that once they completed the graduate, like they graduated, they're like, oh, I'm done. No, when you're applying for any graduate program, you still need the FAFSA information. You still need to know how to log in the system and file through FAFSA in order for any graduate school to consider any aid for you. So I just want to plug that, because students oftentimes think that, oh, they're going to grad school is a complete different thing. You still need the federal financial aid application to submit it to graduate schools, regardless it's health related or not health related graduate program, to use that as a factor to consider the aid that they provided for you. So graduate plus loans or any other related scholarship information. I just want to do a plug there for students in that. So Alexandra, I know you have to run to class, but I would love to kind of see your question that you might have still before going to
I'm
Megan.
gonna have to leave soon because I do have to teach a class. But I was gonna say, don't if you don't get any information about a scholarship, don't not call the school. So like call the school. So for example, I had a student who went to Tufts PT school, and when she got her acceptance letter, there was nothing about a scholarship. So she reached out to them, and I said, just reach out. And she was like, they were like, oh yeah, here. And they gave her a scholarship. Now I'm not saying it's always going to be that lucky.
Gosh.
Either they forgot or they were just like waiting to see. I don't know. But it's always worth at least putting an email out there.
Yeah. And I mean, making that connection, that's amazing. We do try to give out as much scholarship as they will allow. Believe me, I'm like, what can I send more? But if there's any other way, if there isn't any scholarship available, working with financial aid to show other options to help make graduate education more affordable, right? That's our goal.
Great. Megan, let's go to you. Aid, any financial aid, scholarship, what can students expect from med school?
There aren't a lot of scholarships for medical schools. There are some. What we can offer that a lot can't is that we have in-state tuition for Massachusetts residents. So you can save $30,000 a year if you are a Massachusetts resident. That's a big deal. That's why people always want that in-state tuition. If you are applying to medical school, you are probably applying for loans. There are some different kinds of loan forgiveness programs. If you are interested in serving in the military, there are great options for getting medical school funded by the military. There's also different ways to get your medical school loans paid off after the fact. If you are willing to put in some time working in rural medicine, if you are willing to put in some time working on reservations, all kinds of things like that. There's lots of public health options to get your med school loans paid back in part or in full. At the same time, like I said, we're very proud to know that our tuition is a lot more affordable than other places. Even our out-of-state tuition is a lot more affordable than a lot of places. And yes, the hard truth is that pretty much everyone takes out loans to go to medical school. As we were talking about it, if you know anything about finance, even the people who are super rich take out loans to go to medical school because the loans are at a lower interest rate than they're making in their investments. So they actually do. Everyone takes out loans to go to medical school. And if you don't have them as an undergrad, that can feel really intimidating. But I made it this far with no loans. That's great. But the reality is that's how medical school functions. Everyone takes out loans. What you do want to keep in mind is if you are looking at medical schools outside of the United States, those loans are a little bit different, and you do not qualify for federal loans. You do not qualify for federal loan forgiveness. So sometimes if you are enchanted by some of those that take all MCATs and take all GPAs, keep in mind that there may be a little catch there.
That's helpful. And again, this is a very expensive investment. So we always encourage students to make an informed decisions about why you want to choose into health related programs and what might be the ultimate goal afterwards that you would like to utilize a degree to make that difference in the world. So I just want to be clear that because it's a pretty expensive investment and there's a long-term certainly benefit at the same time challenges you still have to do after you finish your medical programs or your graduate program. And then you have to also not just sitting by long, right? What are your options for you to practice and what might be the hinders that might limit your lifestyle as a result of, the expensive price tag that you do tag along to that. So obviously you have to be in love and excited about what you do, and otherwise you won't survive any health related program in general. But I would say obviously plan that and learn about that early will be helpful from our perspective as well. And again, we're here to help you
Absolutely.
navigate that.
One of the things to keep in mind too is the cost of living in the place. NYU made headlines a few years ago when they said no more tuition at their med school. But you still have to pay to live in New York City for 4 years. And there were a lot of students that were saying, even paying full tuition at another school and cost of living, it's cheaper than the cost of living that I have to pay to go there. So keep that in mind. Worcester doesn't have as high a cost of living as some other places. Also, a thing to keep in mind is that many schools, including UMass Chan, have accelerated programs. So you can get your MD in 3 years. In most of these cases, it's for people going into primary care, but sometimes it's for people who want to go into some of the other specialties as well. Like I said, especially pediatrics and women's health and primary care, because those are the ones that we kind of know. People are definitely wanting to do those 3. They know that coming in, so they can commit to that. There's a lot of great things about that. Like I said, you finish in 3 years, so less loans, less cost of living. Also, in most of those cases, you're guaranteed a residency spot. So you know you're going to go on to do residency right there, right where you're familiar, where you want to go. So it's a really nice thing to ask about. Sometimes it's kind of hidden on websites. Ours does advertise the accelerated MD program, but ask about it because I know there's quite a few schools who do have that program and you kind of have to dig a little. So ask them about it. Sometimes you apply for it while you're applying. At UMass Chan, you actually apply for it within your first year at the medical school.
Gotcha. Thank you. And we'll close by saying, close the Q&A part by saying thank you for both of you for the opportunity to share some of the insight from your perspective, from your side of the table, and on tips on how might a candidate or a student applying for opportunity in your program. So Lauren and Megan, thank you. And Dr. Sue, thank you for joining us today.
Wait,
For student in the room, we will still remain for
Oh.
Q&A portions. We're just going to end the recording
Got it.
portions as we speak. So thank you very much. We'll end the recording as we speak now.